Hi, I'm Mataya of Ignite Insurance Group, and I've spent the last over a decade helping people navigate through Medicare, get their questions answered, and find plans that fit their needs. So today, I wanted to address in this video a big question that I get a lot, which is, what is a Medicare Advantage plan? How does it work, and is it really free? So today, I'm going to break this down for you. Medicare Advantage plans are also known as Part C plans. An easy way to remember this is that Medicare Part A plus Medicare Part B equals Medicare Part C. So it makes it a little bit easier if you think of it that way. In a Medicare Advantage plan, everything that's covered under traditional Medicare is also covered under a Medicare Advantage plan. But when you have a Medicare Advantage plan, there are a few different stipulations and different things that go into it. Medicare Advantage plans are different from Medicare Supplement plans. Medicare Supplement plans are those lettered policies, A through N. A Medicare Advantage plan is also provided through private insurance carriers, but it's set up a little bit differently. So if you have a Medicare Supplement or you have a Medicare Advantage plan, you would have one or the other. You wouldn't have both. The system just allows for one plan, either or. Medicare Advantage plans are also known as complete plans, and they're designed to have comprehensive care under one roof. A big difference from going to original Medicare to a Medicare Advantage plan is that typically they're network-based. So if you have certain providers, depending on whether the plan is an HMO or a PPO, it's still important to make sure that any and every provider, doctor, hospital, specialist, anybody who you wish to see providers, as far as providers, you want to make sure that they're included in the plan that you're choosing. The Medicare Advantage plan becomes your primary insurance. So when you have original Medicare, Medicare is your primary insurance, meaning that they're assuming your health risk. When you go into a Medicare Advantage plan, that insurance carrier, whoever's providing the insurance plan, the Medicare Advantage plan, would become your primary insurance, meaning that they would pay primarily on your behalf. So again, it's important to just make sure that any providers that you wish to see are willing to accept that specific Medicare Advantage plan. A big question that I get in regard to Medicare Advantage plans is it really free? How is the premium so low? So Medicare was created in 1965. So there are a number of additional benefits and services that they do not provide. Through Medicare Advantage plans, the private insurance carrier oftentimes will provide some additional benefits and services, some different networks of providers and different benefits. So depending on which plan that you have, you might find that there's some additional benefits and services included at no extra cost. So when a question comes up, is this really free? How come I'm not paying for this? Or how does that work? So the best way I can explain is that when you have Medicare, you have both Medicare Part A and Medicare Part B. And under Medicare Part B, you're paying a monthly plan premium, or most people will continue to pay a plan premium. Whether it comes out of Social Security or whether you pay it quarterly, either way, you are going to continue to pay that premium because it is a federal requirement that you keep both Part A and Part B of Medicare. So when you add on a Medicare Advantage plan, it is designed to be sure to cover, like I said, everything that Medicare covers and more. So basically, your plan is administered through that Part B premium, so that the private insurance company is going to now assume your health risk, so Medicare does not. So that's a big way they are paid, is actually by the federal government, a flat rate per member per month, to take over, become your primary insurance, and then in some cases provide some additional benefits and services. Things like vision, things like hearing, sometimes hearing aids coverage. They also might cover things like over-the-counter credit or fitness memberships. And a lot of times, in most cases, Medicare Advantage plans will also include a prescription drug plan that's considered credible by the federal government. So it is designed to be a very comprehensive plan with a number of different parts of your coverage included all in one. So when you have a Medicare Advantage plan, even if your plan costs you nothing monthly, you will still have copays or some certain out-of-pocket expenses if and when you see a doctor or if and when you have certain medical services performed. You'll also have copays when you pick up prescriptions, when you go to the pharmacy, and things like that. So when you're deciding on a health plan for next year, do your homework, get your questions answered, make sure that you're in a plan that's going to fit your needs for the following year, for the upcoming year. Feel free to reach out. I'm more than happy to answer questions and help ensure that you have the most appropriate Medicare plan for you going into the next year. Thanks so much, and we'll see you next time.